Hi, and welcome viewers of Nursing Academy 101. In this video, we'll talk about Nursing Fundamental Multiple Choice Questions and Answers Part 3. But before we start, please don't forget to subscribe, like and share the channel to encourage us to continue and provide you with all in you. Question number 1. A man has been admitted to the hospital unit with a medical diagnosis of a chronic obstructive pulmonary disease (COPD). He is receiving supplemental oxygen at 2 liters per minute via nasal cannula. Which positioning technique will best assist him with his breathing? A. Fowler position. B. Sims position. C. Lateral recumbent position. D. Lateral position. The answer is A. Fowler position. Question number 2. The nurse caring for a frail, malnourished, immobile patient recognizes which of the following as the best treatment to protect the patient's integument? A. Offering the patient 6 small meals a day. B. Assisting the patient to sit in a chair 3 times a day. C. Turning the patient at least every 2 hours. D. Administering fluid boluses as directed by the healthcare provider. The answer is C. Turning the patient at least every 2 hours. Question number 3. The nurse is helping the patient to perform leg exercises after surgery to prevent thrombophlebitis. Which type of muscle is the patient using for these exercises? A. Skeletal. B. Smooth. C. Cardiac. D. Slow twitch fibers. The answer is A. Skeletal. Question number 4. A nurse is caring for a 25-year-old male quadriplegic patient paralyzed. Which of the following treatments would the nurse perform to decrease the risk of joint contracture and promote joint mobility? A. Active range of motion. B. Turning the patient every 2 hours. C. Passive range of motion. D. Administering glucosamine supplements. The answer is C. Passive range of motion. Question number 5. What is the correct method for turning an adult patient who recently sustained a spinal cord injury? A. Ask the patient to assist with the turn by holding the side rails of the bed. B. Place a draw sheet under the patient to assist with turning. C. Request help from another nurse to perform the log rolling technique. D. Use a mechanical lift for safe turning and protecting the nurse's back. The answer is C. Request help from another nurse to perform the log rolling techniques. Question number 6. In order to achieve balance, body mass must be distributed around which point? A. Center of body alignment. B. Center of balance. C. Center of gravity. D. Base of support. The answer is C. Center of gravity. Question number 7. A patient is on strict bed rest for 5 days. During this time, he has not had a bowel movement. Normally, he passes stool daily. He describes feeling bloated and uncomfortable. A nursing diagnosis that would be addressed a patient who is on bed rest is constipation related to A. Change in previous pattern. B. Immobility. C. Dietary intake. D. Change in environment. The answer is B. Immobility. Question number 8. A nurse who works on the orthopedic unit notes that in addition to providing support, bones perform other functions in the body. Besides support, which of the following is an important bone function used during activity and exercise? A. Hematopoiesis. B. Protection. C. Mineral storage. D. Movement. The answer is D. Movement. Question number 9. The nurse is assigned to a 79-year-old patient who has decreased mobility resulting from a stroke. The nurse understands the interventions to prevent skin breakdown for this bedfast patient is to include repositioning of the patient at least every hours. A. 1. B. 2 hours. 3. 3 hours. D. 4 hours. The answer is B. Every 2 hours. Question number 10. A nurse and another staff member are preparing to reposition a patient in bed. To prevent back strain, these two healthcare providers must do which of the following? A. Keep their knees stiff to enhance their lifting strength position. B. Keep the weight of the patient as close to their bodies as possible. C. Loosen their stomach muscle to keep from injuring the pelvic region. D. Twist their upper torsos to enhance the use and strength of their upper extremities. The answer is B. Keep the weight of the patient as close to their bodies as possible. Question number 11. Immobility is A. Is the inability to move freely and independent at will. B. Is the ability to move freely in the bed. C. Is the inability to move freely and dependent at will. D. Is the ability to move freely on the chair. The answer is A. Is the inability to move freely and independent at will. Question number 12. What is the effect of immobility on respiratory system? A. Atelectasis. B. Venous stasis. C. Orthostatic hypotension. D. Weakness. The answer is A. Atelectasis. Question number 13. Body mechanics is divine. A. Coordination between nervous and cardiovascular system. B. Coordination between cardiovascular and respiratory system. C. Coordination between nervous and musculoskeletal system. D. Coordination between urinary and nervous system. The answer is C. Coordination between nervous and musculoskeletal system. Question number 14. Orthostatic hypotension, one of the complications of immobility on which system? A. Cardiovascular system. B. Respiratory system. C. Urinary system. D. Musculoskeletal system. The answer is A. Cardiovascular system. Question number 15. A nurse observed the calf muscles of a client on bed rest for redness, swelling, and tenderness. In addition, the nurse measures the calf muscles circumference. For what problem is the nurse assessing? A. Thrombophlebitis and edema. B. Decreased joint range of motion and weight loss. C. Dehydration and edema. D. Joint contractions and thrombophlebitis. The answer is A. Thrombophlebitis and edema. Question number 16. A patient suddenly develops right lower quadrant pain, nausea, vomiting, and rebound tenderness. How would the nurse classify this patient pain? A. Acute, B. Chronic, C. Intractable, D. Neuropathic. The answer is A. Acute. Question number 17. How should the nurse classify pain that a patient with lung cancer is experiencing? A. Radiating, B. Deep somatic, C. Visceral, D. Referred. The answer is C. Visceral. Question number 18. In which process do peripheral nerves carry the pain message to the dorsal horn of the spinal cord? A. Transduction, B. Transmission, C. Perception, D. Modulation. The answer is B. Transmission. Question number 19. A patient reported that he used music therapy to help control his chronic pain. Music therapy works by prompting the release of endogenous opioids during which stage of the pain process? A. Perception, B. Transduction, C. Transmission, D. Modulation. The answer is D. Modulation. Question number 20. The nurse is assessing an intubated patient who returned from coronary artery bypass surgery 3 hours ago. Which assessment finding might indicate that this patient is experiencing pain? A. Blood pressure 160/82 mm Hg. B. Temperature 100.6 Fahrenheit. C. Heart rate 80 beats per minute. D. Oxygen saturation 95%. The answer is A. Blood pressure 160/82 mm Hg. Question number 21. Which nursing diagnosis is most appropriate for the patient who returns from the post-anesthesia care unit after undergoing right hemicolectomy surgery for colon cancer? A. Acute pain secondary to surgery. B. Acute pain abdominal secondary to surgery for colon cancer. C. Chronic pain secondary to cancer diagnosis. D. Chronic pain abdominal secondary to abdominal surgery. The answer is B. Acute pain abdominal secondary to surgery for colon cancer. Question number 22. The nurse plays music for a child with leukemia who is experiencing pain. Which pain management techniques is this nurse using? A. Distraction, B. Guided imagery, C. Sequential muscle relaxation, D. Hypnosis. The answer is A. Distraction. Question number 23. A patient is prescribed morphine sulfate 4 mg intravenously for post-operative pain. Which action should the nurse take before administering the medication? A. Monitor the patient's respiratory status. B. Auscultate the patient's heart sounds. C. Check blood pressure in supine and sitting position. D. Monitor the patient for psychological drug dependence. The answer is A. Monitor the patient's respiratory status. Question number 24. What is typically the most reliable indicator of pain? A. Patient self-report. B. Past medical history. C. Description by caregiver. D. Behavioral cues. The answer is A. Patient self-report. Question number 25. A patient reports to the nurse that he is experiencing a moderate amount of back pain, rated 6 out of 10 on the pain scale. What should the nurse recognize about this assessment? A. Pain is objective for the nurse. B. Pain is easy to recognize. C. Pain is subjective for the patient. D. Pain is easily relieved if found early. The answer is C. Pain is subjective for the patient.